when we look at ADHD symptoms, we don't see a separate group. We see people have lots of symptoms, people have a moderate amount of symptoms, people have few symptoms, but there's no distinct cutting point with like there is for intellectual disability. And so that tells us that ADHD is kind of more like a trait in the population. More like let's say personality, other kinds of traits that everybody has a little bit of. And when we think of ADHD as a disorder or as a problem, so it's very much like hypertension. Everybody has a blood pressure, but some people have a very high blood pressure. Everybody has a cholesterol level. For some people, cholesterol is too high.
What do you think? Because there are some patients who say, ADHD is just a genetic predisposition or genetic difference. It doesn't necessarily mean that I have to be treated. I mean, when I said, let me make a disclaimer. When I said treated, I do not mean medication.
No, if somebody with high blood pressure came in and said, I'm just different, I don't need to be treated, I would say the same thing. You're an autonomous individual, but you could eventually have a heart attack or something because of your high blood pressure. It's actually kind of dangerous. And I would say to a person with ADHD, there are risks associated with ADHD that you need to consider when you balance these things out.